So what is the purpose of skinfold assessments? Skinfold assessments are basically used to determine the amount of subcutaneous fat that a person has, and this fat is located directly below the skin. They are also used to determine body composition. These measurements are based pretty much on the assumption that 1/3 of total body fat is located subcutaneously, and the amount of subcutaneous fat is proportional to total body fat.
What you see now is the instrument we will be using for this lab, and this is a caliper. What you do is you place a caliper 1 centimeter away from the thumb and your index finger. You measure halfway, point between crest and base. The readings will be taken vertical fold or diagonal fold, and this is between 1 to 2 seconds.
Before starting your Skinfold assessment, you want to be sure that your patient's skin is dry and lotion free. All measurements must be taken on the right side of your patient's body. You also want to identify all sites before measuring. Once you take the Skinfold as previously instructed, you want to record the Skinfold measurement to the nearest half millimeter 1 to 2 seconds after releasing the caliper. Take a minimum of 2 measurements in a rotational order to allow time for the Skinfold to regain its normal thickness. If measurements are not within 1 or 2 millimeters, retest the site. Once you have your measurements, calculate the average for each Skinfold using the appropriate Skinfold equations. These equations will give you an estimated percentage of body fat. So first we're going to be taking the tricep Skinfold. It's a vertical fold, which is between the shoulder and the elbow. And the measurement is 13.
I'm going to be doing the mid-auxiliary fold line, and it's located side forward of the midline of the sternum. It is a vertical measurement. The reading was 10 millimeters.
Okay, so the next skinfold we're going to take is the abdominal one, which is 2 centimeters to the right of the belly button. So you want to go ahead and get a good pinch and shake it off. And that's going to be a reading of 12 millimeters.
So I will be taking her suprailiac skinfold side, and this is a diagonal fold in line with the angle of the iliac crest, and this is anteriorly from the axillary, and I will be taking it. And this reads 10.
Now we're going to be measuring the chest fold, which is the diagonal fold. It's for men it would be 1/2 the distance between the anterior axillary line and the nipple. For women it's 1/3. So and it's 10 millimeters.
Today we'll be completing the skin fold measurement for the thigh. It's midway through the thigh, and it's a vertical measurement. And so I'm going to go and proceed on doing it. And it read 20.
So the next site we're going to be doing is the subscapular site, and that one's located 1 or 2 centimeters below the inferior angle of the scapula. And it's also a diagonal fold, so you pinch it at a 45-degree angle. So I'm going to go ahead and take that now. And I got 25 millimeters.
When it comes to using skinfold measurements as a way of assessing body fat, there's a couple of pros and cons that you might want to consider if you're thinking of that route to go. Some of the pros would be that the calipers aren't very expensive. They're easy to get their hands on. You can buy one for a decent one for about $15. Another pro would be that it's very portable. They are not that big, so it's easy to take anywhere. And another pro would be that it's fairly fast to take the skinfold measurements. Some of the cons would be that some measurements can't be done unless there's another person taking them. For example, the subscapularis site is right next to the scapula, more medial, and it would be very hard to take that measurement on your own, or at least you wouldn't get an accurate reading. Another con would be that the skinfold procedure relies on the assumption that may or may not be true, and that's that the fat under the skin is proportional to the total body fat. And one of the last cons, this one's not really a con, but it's something you need to consider, is that the proper technique requires a lot of training. So if someone who isn't properly trained is taking the measurements, then that could give you some false readings and false information about your body fat percentage. And these were just some of the pros and cons of using Skinfold measurements as a way of assessing your total body fat.